All right. I wrote it down because I had to record a few times because I forgot something. Um, the pros and cons of being a PCT at a dialysis center. Because I remember when I was searching, I didn't really had I didn't find what I was looking for. I didn't feel fulfilled in the information. So I'm going to start with my pros because it's a short list because my cons is way longer. um, the pros, I'm about at my 3 month mark. The pros are the benefits are, I guess, pretty good. They do give you the lunch the breaks are pretty good because you get a 30-minute paid break in the morning and then you get a 45-minute unpaid break in the afternoon. The PTO, paid time off, seems to be pretty good so far. I'm just starting still, but that seems to be accumulating so far. Okay, now to the cons. And if I remember any more pros, I will add. But now to the cons. The pay. Me transitioning from making $60,000 to this because I was driving an ASL truck. Recycle route, shall I say. It is quite different. You have to love taking care of patients. And a lot of people ask, well, why did you choose dialysis? Well, since COVID hit, I didn't want to go into the hospital. The nursing program that I'm going to, most nursing programs, they require medical background. So dialysis was one of the closest things to the hospital. The hours can be very long and hectic at changeover. I'll explain that more later. The patients. Oh, one of the pros that I forgot to say is that some of the patients become like family. You see them 3 times a week, sometimes 4. Sometimes you get very close. But one of the cons is they're not here. Like they pass away. Like I was just talking about this guy in a Zoom meeting at work the other day. And I didn't even know that the guy passed away. So that's one of the cons is, they is like here one day, gone the next. Another con is that some don't, and this is not to be taken in an offensive way, but some are very needy. And when I say needy, like they have to solely depend on you. Okay, you have to go get them out the waiting lobby. You have to push them in their wheelchair. When you take them to get weighed, you have to push them. Some people can't stand, so you have to push them. You have to subtract their weight, when you loading everything in. So basically it's like, yeah, they need you. And sometimes if they can't even, if like they're paralyzed or can't walk, we have to use this machine. We have to get another team member. We use the machine. We kind of lift them up out of their wheelchair, into the dialysis chair. And, the machine kind of does the heavy lifting, but then you have to position them to sit them correctly. Or if they have one leg or no leg, etc. This is all the cons. A lot of blood. You're dealing with a lot of blood, because you stick in them twice. Catheter care is not as bad as the needles. But yes, you stick 2 needles 3 times a week, and then, you pull in the needles. But you would think the larger the number of the needle, it's the total opposite. The larger the size needle, the larger number, like a 16, 17, those are the smaller needles for like premature or immature access. That means they have a new access that hasn't matured yet. And like 14, the biggest needle is a 14. Then they have a 15 and a 16, 17, etc. Another one is, another pro is when working with certain coworkers, they make you feel very welcomed and they are very helpful. But one of the cons is working with certain coworkers, they don't make you feel welcomed. They don't really help you, being a new tech. Another con is the hours. Having to be there 4:30, 4:15 in the morning or 5:30. 4:30 as the opener. I've been doing a lot of 4:30s because we have to set the machines up, get them ready, and then the rest of the crew coming at 5:30. So, just getting up at 3 o'clock in the morning, I'm used to it, but it can be hard on some people. Machine problems. When setting up the machine, sometimes the machines, will go out, or you have to, if something goes wrong in the middle of treatment, you have to kind of manually hand crank the machine to keep it going so that blood won't clot. It's a lot of problems with the machines. Sometimes people blood clots. The machines will go out, it alarm all the time. It's pretty loud up in there. Don't think, you can get a nap up in there. I'm just talking about for the patient point of view. Access, when you're sticking. Being a new tech, kind of trying to get the angle in, how to angle the needle. And a lot of people has these different funky accesses, what they call it, funky. My son. The term crunchy. You probably won't understand that term until you start sticking. And you're like, crunchy? Yes, crunchy. I was just like, well, why don't you just call it a brick? This one lady, they call her access crunchy, but now I know why, because it's very hard and it has that crunchy feel and sound when you try to stick. It's just very hard. Some people have, like this guy, he have like an access, like a horseshoe, like an upside down horseshoe. So it's just many different things. Catheter care, it's a lot to do with catheter care, but it's a lot easier than sticking. If you have anxiety, your anxiety will definitely be through the roof working there. I'm not gonna lie. Gordon, what are you doing? Oh my gosh, my son. Let me see. In my pod, we do about 4 patients. So, I feel like it's not fair that they want you to they schedule the patients 15 minutes apart. So sometimes it could take a person 10 minutes just to get in there. Some people want to talk to people. Hey, talk to the whole clinic. Hey, how you doing? So that kind of slows you down, because when you get them there, you got to get their blood pressure, subtract their weight. That kind of tells you how much, fluid you got to pull off of them. And with some people, they can't pull a lot of fluid because that's a lot of stress on their heart. So, and then some people, you got to watch them, because they will, this is another con that was very scary to me in the beginning. Some people will go out in a blink of an eye. And when I say go out, you could be talking to them, hey, such and such, how you feeling? I'm fine. Next thing you know, they be out. And you got to make sure their feet is up, their head is back. Sometimes you got to get them a cool rag. You got to go. Sometimes you got to get them a cool rag. It's just you got to always be alert. You got to always think fast. I don't take offense. I don't take it personal, because I know that when you're depending on a machine to save your life, it can be, I guess, a little stressful or hectic, but some of them can be just as nice as ever, and some of them can be just as mean as ever. Some people can curse at you. Some people can call you every name but the child of God. Um, I've had this guy. He does that with everybody, but then he tries to be nice later. So I just keep my distance. I keep it professional. But it was one day that I really wanted to say something, but I had to hold it, not say anything, keep my peace, breathe, and keep it moving. But that's one of the things, yes. And let me see. Monitoring their blood pressure. Some people, like, for example, if their blood pressure is really high or really low, you can't let them leave. So that's one of the things I feel like that's unfair about the whole 15-minute, scheduling thing. If your blood pressure is too high or too low, we can't let you leave. And then you got a person who shows up. Some people show up an hour or 2 hours early and then want to get in. It don't work like that. These chairs are scheduled. If I don't have a chair open, I can't get you in. That's one of the things too that I feel like patients don't understand, because they will come, get mad, and then some people want to leave early. And then if you had someone scheduled to get off, say for example, I had someone scheduled to get off at 10 o'clock, but then I got somebody over here who's either sick or just want to get off early just because, it don't work like that. And you got some people who will, how should I put this? Another thing too that I realized, sometimes you care more about patients than they care about themselves. And my example of that is, some people don't show up. You can only go but so long before you won't be able to survive, shall I say. Because what dialysis is doing, it is cleaning the toxins out of your blood. So if your blood is accumulating a lot of toxins, you're not gonna most likely survive. So sometimes we'll call people, hey, are you coming in treatment? Or some people, I feel like they take it as a joke, but when they're on their deathbed, they kind of like want to straighten up. Or, just dealing with family members who can be, a pain in the neck. Like, for example, one of the techs, I guess, she'd been there for years. I think maybe about 7-10 years or something like that. And she was calling one of the patients because she haven't heard or seen her for a while. And the daughter was very nasty to her. And she was like, are you calling to be nosy? Or you call? And she was like, what? I'm calling because I care about your mom. I'm worried about her. And it's sometimes those are it's some of the things that, you have to deal with, but you just have to be professional. And I feel like, and even my coworker was like, she's like a mom to me. And the daughter was like, well, she only had 3 kids. She is not your mom. And to me, if someone is taking care of my mom, I would not be nasty. I'll be like, hey, she's fine. I'll give you an update, or when she's feeling fine, I'll have her to call. But some people are just very, very, very rude and very nasty. So that's you have to deal. That's one of the things you have to deal with. Then, now with COVID, we don't take COVID positive patients. And if they have symptoms, we have to send them to another location that takes, our sister location that takes them. But it's scary because you don't know. Some people will lie and tell you, or they don't have any symptoms. So for me, you know, I wear my safety glasses or my shield. I wear 2 masks. And now, to be honest, I feel like I want to put on 3. I might can't breathe, but I feel like I want to wear 3 masks. And, you know, we washing our hands, sanitizing constantly. So your hands is like sharp because they're so dry. And it's just a lot that you have to deal with. So if you don't have a strong mind, you know, I don't know what to tell you, because you have to be strong. You have to be firm, because this is not for the weak. And that phrase, you know, that I've always heard from a lot of other people, that nurses eat their young. It's not only nurses. It's other techs and other CNAs and other, you know, just anybody in that field. For me, I don't care how long I've been doing something. I would never make a new person feel unwelcome or not wanted, or, you know, make them feel like they, you know, stupid or something. Because I felt that one day, or, you know, like, oh my gosh, like, is this job for me? And then you think like, gosh, I got too many credentials for this BS. You know, to be honest, you do have your rough days. And I'm thinking like, okay, I got plenty of things I can fall back on. I have my cosmetologist. I've been a cosmetologist since 2007. I have my cosmetology instructor's license. You know, I do cranial prosthetics, and, you know, a lot more in the making. I have my CDL. So it's like, do I really need this? But when you think about helping someone, you know, that kind of just fades away, because it's like you're saving someone. So you have to really love it to be in it, because a lot of people start and they quit. Like this one girl, she started and the next day she worked 1 day and she quit. So you have to really love it. And I see people going, they cry, they go in their car. You know, and one day I felt like I wanted to cry, but I'm like, bump this. Like, I'm not a crier, but, you know, it makes you feel that way. You could be a complete bad A, you know, hard person, and this job can break you down some days. So I just want to give I'm not going to make this long. I just want to give a quick summary on the things that I, you know, searched for and didn't get to hear before starting. So I hope this helps someone. Another thing that I forgot to mention earlier, pertaining to like the scheduling, why I feel like it's not fair about the 15-minute thing. You know, some people have a graft and some people have a fistula. A fistula, basically, you know, don't quote me on it, but you can put a clamp, like some people who can't hold their access. Okay, after you pull the needles, you have to apply pressure for, you know, 10 to 15 minutes or so, because some people bleed. So you can't put a clamp on a graft, if I'm not mistaken. But on a fistula, you can put it on there. But the max time is 15 minutes. So that's one of the cons also for some people who can't hold. So you will have to sit there and either hold it yourself with your hand, sit there and hold it, or you put a clamp on it, try to go tend to your other patients and get back in 15 minutes. So it's enough. It's a lot. Just wanted to add that in. 14. Huge. One of my best friends, her baby. The 15 one. 14s is huge. This is 16. Gets a little bit smaller.